All right, so summary of our patient interaction from the other day, or lab one, day one of lab. Patient was a 7-year-old male with Down syndrome. He presented to clinic with his mother. We attempted to perform a gross motor function measure just by observing his play and through interviews with his mother, just getting information from her, how he was doing. During the therapy session, his play was often sporadic, and we found him having a very hard time focusing. There was a lot of distractions, possibly due to the new environment that he was in, and just there was a lot going on. So in the future, I think we're going to try to limit his distractions and narrow down his focus for
To narrow down the problem areas we noticed in Brody, we are going to focus on posture control. We're going to focus on his gait efficiency. He tended to be pes planus and externally rotated. We're going to look at his gross motor function with throwing and jumping. He tended to throw backwards and not at a target. He also tended to, when jumping, he would not jump unless his hands hold down off a step, and he also barely cleared his feet when jumping up from the floor, and also just in general his focus and attention to task when trying to perform our observation eval.
Upon discussion with Katie, instructor noted difficulties with patient's attention and focus, which led to difficulty throughout the session. And instructor also noted the lack of goals during play with the child.
So, to plan an outline for our intervention next week, we were going to start with Go Noodle videos that include dancing. And then we were going to move on to different scooter activities, so Santa's reindeer scooting on their stomach, acting like a swimmer, or even him just being pushed around on the scooter.
Okay.
And then we were going to do an obstacle course with goals involved, because we were told that that would really help keep them focused. So different things like hot lava, playing baseball, and utilizing the trampoline will be involved in an obstacle course. And so as far as case-related issues and topics for self-study, we really wanted to find out how his core control can relate to increasing the benefits of therapy in Down syndrome.